Centre for Addiction and Mental Health is the #1 mental health and addictions hospital in Canada. We actually have a number of locations in Toronto and Ontario. Apart from the clinical care we provide, we have a very large research department as well as a very strong education group.
So this past year was really a transformational year for us. We implemented our electronic patient record, which is based on Cerner, across our entire organization. So in order to do that, we knew that we needed a good partnership to support the infrastructure underlying that project.
CAMH has been in an outsourced environment for a few years now. With the contract we had with our previous provider, we decided to go to market and test what was out there. We wanted to find the best provider of managed IT services that we could find, especially around IT infrastructure.
We actually made the decision to work with CompuCom and transition all of our IT support services to CompuCom just in advance of the go live of our electronic patient record system. So to say it was a hectic process, I think would be an understatement.
We needed the transition to be smooth and fast. Our transition with CompuCom took only 3 months, and that included hundreds of servers, real data center moves, migrating a whole number of services, and we were able to manage to do that on time and on budget.
I could not have asked for more, I have to say. Usually you're happy when a project is relatively on time, on budget. This past year, we've implemented more than I would expect an organization to successfully implement in a 5-year time frame. So not only have we had a very successful and smooth transition to our IT managed services, but we've also been able to support a major new strategic initiative. So what I've learned, first of all, is that success is highly dependent on people. And we've benefited from having some exceptional people work with us. And really, I owe the success of the project to the people that were involved. The technology is actually the easy part. And the challenging part is process. You can't underestimate change management and supporting people through change. So it's one thing for us to implement a lot of innovative new technology, new support services, other things within our organization, but we need to do that providing really solid support and helping our staff through that change. That's one of the things that CompuCom brings to the table. Our goal is to make technology invisible. And we've outlined in our strategic planning, we want technology in this organization to feel like electrical power, as an example. Nobody questions when you plug something into an electrical outlet whether it will work or not. And we want to have that same level of reliability, that same level of service for the technology infrastructure as well.
Healthcare is a bit of a different beast, and you have to understand some of the nuances around it. And I think CompuCom brings to the table that knowledge. We're dealing with patients here, we're dealing with critically ill patients here.
The end goal is not about where our servers sit, where our data center is, what our network is doing. The end goal is, can we improve the experience for our clinicians? Can we ultimately make their lives a bit easier so that they can have more time and more energy to devote to treating patients? And that's what we're about.
Our primary focus has been on patient safety, and we have achieved that.
CompuCom, having so much experience in the healthcare sector, really provides that understanding, that knowledge, that view of the unique attributes of what helps technology within healthcare be a success.
In the longer term, we are really looking for CompuCom to be our trusted partner and advisor. We are really looking to continue to be at the forefront of technology, and we would like CompuCom to lead us there.